Thank you for coming by. I'm Dr. Schargel, Konrad Schargel. Even with that, such a German name, I'm Spanish. Very Latin, very, very Latin. I'm going to tell you my experience. This is a short presentation, but please cut me in any moment that you want. It's just to talk about how we can improve our angular surgeries for all of you interested or already doing angular surgery. This was my previous experience in Spain, and you can see the green line. We started very early with angular surgery, but it was mainly for research. But when it started getting commercialized in 2013, by 2016 was our most popular surgery out of all. And this is in part with the difference with Saudi Arabia. This is the type of surgeries I do in Saudi Arabia. MIGS are not the most popular because the center that I work only manage very advanced and severe cases. So we all know that MIGS surgeries are for moderate cases, mild to moderate cases. You can use in some severe cases, but you probably are not going to get the amount of pressure that you want. If you need 50, 60% reduction, MIGS are not. But our cases in Europe, thanks God, they come to see us much, much earlier than in some other places. So basically, it's not only reducing the pressure, it's also reducing the medications, and our trabeculectomy sometimes cannot be our hero. And MIGS, I really believe that came here for give us a hand. In my surgical algorithm, MIGS are right after trying SLT, medication, especially if the patients are booking for cataract surgery. We know the characteristic of the MIGS. This was described by Ahmed. And the success for MIGS depends basically choosing the right patient and doing the technique properly. We have all these surgical techniques for angular surgery, so sometimes we are in a doubt which one we're going to choose. Most of the angular surgery target the filtration area. How we recognize the filtration area? As soon as we decompress the eye, 80%, we are going to have that line of blood that fulfill the Schlemm canal. This is the place we have to target with any angular surgery. And angle similarities comes especially for a good evaluation done in the clinic. And it's exactly not the same thing, but it gives us an orientation. So the gonioscopic principles, we know that the internal reflection of the cornea makes that we are not able to see the angle, but we use these two devices, indirect and direct gonioscopy, precisely to surpass this internal reflection. So let's talk about the gonio ready a little bit that we have. The patient selection, as I mentioned, I'm not going to say much things about it. If you had something like this, which is a baby that I took the picture in the King Khaled Eye Specialist, you don't need any lens to see the angle. You have such a huge keratoglobus that you see all angular structures by itself. If you have a case like this with opacities in the periphery, you cannot do any angular surgery. So patient selection is critical if you are going for angular surgery. And one thing that is very important when you are planning to do any angular surgery is be sure that everything you need is going to be nearby. Sometimes we need a lot of things to do some of the surgeries. So why we have the gonio ready, I believe the Oculus has the brilliant idea of put the hands where we need to have the hands. Some of our angular surgery, as this is an ABIC surgery, you can see that there are like 4 or 3 hands in the field. So the idea is that if you use the lens, you can keep your hands just for what is important, which is the surgery itself. So To look the angle structures, basically there are three conditions that are important, which is the position of the microscope, position of the patient, and the angular lens. Position of the patient is just the tilting. If the surgery is being done by topical anesthesia, the patient can give us a hand by looking to extreme opposite side, and then you will have a full view of the area of the angle, which is the nasal. That is the one you need. Tilting of the microscope, it doesn't matter which microscope you had. I prefer the Leica because I can set in my parameters automatically the tilting of the microscope, but it doesn't matter. It's as far as you easily can tilt the microscope, it's good. You need to tilt about 30 degrees to get the proper view of the angle. What about lenses? There are many lenses in the market. You can see we have in the superior picture, left side is the Swan Jacobs, it's probably the most popular. In the middle is the Quan, which is a brilliant idea mounted over a Thornton fixation ring. The thing is that it's huge, so you really are having problems to put the instruments inside of the eye. The one that you are seeing in the video is the Mori lens, which is an indirect lens. It's very good in the way that the area to introduce the instruments is quite open. The problem is that as it's an indirect lens, most of the light will be missing into the three surface that has to get into the angle. The TVG is a good device, also mounted on a Thornton fixation ring, but all of this needs mainly to use the non-dominant hand to hold the eye. You need to do a consistent light pressure over the eye to stabilize the eye, and that can cause some faults in the cornea. If the patient moves, you do this pushing a little bit harder. There are some other type of lens, like self-stabilizing free-floating lens, that they are very good. The only problem that you have is that sometimes they displace out of the position that it should be. And when this happens, especially because they have a large profile, we lost the critical moment. All of this still being two hands lenses. So this is what the idea of having something that will allow you to have the both hands free, it's clever. The idea is to have the best vision we can get from the angle in order to decide which surgery we want to do, and if the eye is suitable for that angular surgery. Let's talk a little bit about the gonio ready itself. This is a gonio lens that is mounted on the microscope, and the main idea is that really will give you both hands for the surgical procedure itself. This is the package that it comes. You have the sterilized disc, you have the device itself, and you have the nut that is going to help you to attach to the eye. This flexible, I don't know if we could call like spring, but this flexible silicone part of the device, it's what it helps us to adjust the eye even during movements of the eye. Let's highlight some 5 properties that I see. Well, really you have the two hands free for the surgery. It gives you a consistent, stable imaging of the area that you're going to need. So no matter the surgery you are going to do in the angle, you have the areas totally clear. It doesn't need a sterilization because it's a single use. There is no right and left, as most of the handheld lenses. And you don't need to do additional corneal pressure in order to keep the lens in the right position. How we adapt it. For our staff, if they are training ophthalmic procedures, is exactly as the biome. The biome is the system for long time used for retina surgery. Well, this is the first part that it goes attached to the microscope. The first time is sterilized. Then it comes this package, fully sterilized. You can see that it has a ring to protect the field. It goes upwards, so it allows for the staff to prepare the rest of the instruments and equipment you're going to use that day. Once you have everything in place. Put the lens in the position, apply some viscoelastic over the cornea so it will adapt properly over the cornea. Better to be a dispersive viscoelastic, and then you lower the lens by the knot that is right there, that is fully sterilized. And then you can move the rest of the parameters, the focus and the position of the lens with the foot pedal, and the view is fantastic. I mean, you had a full wide range, totally clear view of the angle. And once you finish, if you want to aspirate the viscoelastic from the anterior chamber, it's very simple to pull it up. So in summary, I think that MIGS surgery, even for the ones that are not used to it, it's becoming more and more popular. So it means that we really have to train. We train 10 fellows a year in the King Khaled Eye Specialist. So I always said to them, this is probably not the final technique, but it's going to be a first step that you have to learn for the next and future techniques. There are many optical devices for assist you in angular surgery. When you have a special long surgeries in which you consider that you might need the two hands, this is the advantage that I found in Gonio Ready, that you will have both hands fully available for the surgery, and it's based on the Bion system, which makes that the staff is absolutely familiar with this. The only thing is that you as a surgeon has to get familiar to it. So thank you very much for passing by. I think you have the Gonio ready to practice if you want. You can just tell the people of Oculus. Thank you very much for the invitation anyways. If you had any question, I'm open for it. But you came late. No, so you cannot ask because you were not here.